But when it comes to knee support, we want 360-degree support of all the muscles around the whole limb, affecting up into the hips, the knee, calf and the foot. But you can see here the hamstring, the joint line is just here. So the hamstrings connect about 1 inch below the joint line. The calf then connects about 1 inch above the joint line, which means they act like a monkey grip. So calves and hamstrings, having them strong, massively support the knees and take away pain in the knees too, especially pain in the front of the knees. So with the quadricep muscles here, if this muscle here isn't firing too well, or isn't developed very well, which is very common, the knee tends to track out the outside here, so it doesn't actually sit in the groove well enough, and that can cause pain underneath the kneecap or pain underneath the knee. It's sore when you're sitting like at the movies for a while. It gets sore. You can't sit with a bent leg for that long. This muscle here, the adductor longus, that one's really important for controlling pelvic position, and also look how it supports into the thigh. If that's weak, that'll cause an issue going on the inside of the thigh. That muscle is very commonly weak when there's knee problems. And then when we look down here, this muscle here, adductor magnus, it's a massive muscle for knee support. So that one, the body always calls on this muscle when it needs more support from other muscles, and we can maximize the strength of this one big time. Look how it connects right into the inside of the knee here. So if this isn't working too well, it gets really tight. It causes the pelvis to rotate and all sorts of stuff. And of course we've got the ITBs here. ITB is down the side of the body here. It's a passive structure, so if the muscles aren't working too well around the ones that I just showed, the body goes, okay, I'll use here to try to transmit force. And it does that naturally anyway. It transmits force from the hip to the knee or from the foot up to the hip. And it can be very tight in people for various reasons, but it's usually because there's certain muscles not doing their job. Mainly the glutes can be what's happening with the diaphragm and the obliques as well. And this here just shows also that if someone's got a problem with a knee, it's often the glutes on that side, or even an ankle or an Achilles tendon issue on that side. The same side glute doesn't fire too well, which can make this lat really tight because it's trying to stabilize this weak part here to help this part here. So cross body pattern. So a problem with biomechanics on the right side, so that's just how the limb's moving on the right side, how the hips stabilizing, can be a direct cause of why this shoulder problem on the opposite side isn't healing. So I look at these sort of things. If you've got knee osteoarthritis, which is they call wear and tear of the joints of the cartilage is being worn away inside the knee, it can present as pain when walking, pain underneath through here, pains on the sides of the knees as well. When it's really in a bad place where people need a knee surgery, there's night pain. So what position the leg's in, there's pain at night and you can't sleep. That's at a place where it sort of needs surgery. But before the surgery, it's best to get the muscles around the knee and the hip as strong as possible, because it helps outcomes. And then once you've had the surgery done, then you need to get lots of physiotherapy and help to get the muscles all strong around the knee and around the hip, so that you can use your leg for the rest of your life. And we want to get the range of motion back in the knee too. So I just come across people with knee injuries and they've been diagnosed with osteoarthritis in the knee. It's nowhere near close to getting a knee surgery. A lot of people just assume that once they've got osteoarthritis, down the track they'll need a knee surgery and that'll fix the problem. It's a really short-sighted way of thinking about the body. The body's got a tremendous ability to be able to heal. And the reasons why osteoarthritis comes in the knees is two things. One is from an accident. If you have an accident in the knee, it can accelerate that kind of process. So that's something that can't be sort of helped. In terms of the accident itself causing that, what you can do is to maximize the amount of movement and the strength around the knee and the hip as much as possible. That's how you can help it. So you're doing exercise, specific exercise, and load sharing exercise. Then if you've got osteoarthritis that's just come from seemingly out of nowhere with no accident, it means that you're not using the joint well at all. So when we're looking at knees, we need to look at what's happening with the foot, what's happening with the ankle, what's happening with the hip, even what's going on with the diaphragm, rotations of the pelvis, that kind of thing. So load sharing is the key point when it comes to knee osteoarthritis and any knee problems. So what load sharing means is, like, if I have to lift something heavy If I just lift it all myself, or if I don't lift very well for starters, all the pressure goes in my back. If I use my legs to lift, I've just shared the load with not just my back, but with my legs now too. And if I'm using my shoulders well, I'll spread it through my back better too. So that's sharing load through the body, so it doesn't just go on one point. Or I could ask someone to come and help me, can you help me lift this? All of a sudden the load's less, it's not going to one point. So the exact same principle happens with knees. If you're not using the knee well, it's like every time you step, there's this jarring force that goes into the knee all the time, and I see this a lot. People who walk like this kind of thing, means that they're using a side-to-side motion to make a rotational activity that walking should be. So that person's got glutes that aren't working very well. Generally the core's not very strong, and there's just massive load going through the knee all the time, or going into the knee. The knee's meant to be a load transfer joint, which means that the load goes through the joint to the foot. It's not meant to be a load bearing joint. So the hips are better as load bearing joints, the foot's better as load bearing joints. Load bearing means that all the pressure goes into the knee and it stays there. It's not meant to do that, it's meant to go through the knee. So how it goes through the knee is how you use your body. It's to do with load sharing, it's to do with how strong the muscles are in your glutes, adductors, this teardrop muscle here, the vastus medialis, how strong your quads are, how strong your calves are, how strong your hemis are, how flexible your foot is, the midfoot, the middle of the foot, this section here, should be able to twist quite a lot. If it doesn't, the force then of rotation goes into the knee. That's not good. Your hips should also be quite flexible. So you should be able to make quite a bit of motion in the hip joint, especially with this internal external rotation. And if you can't get that happening, the force goes into your knee for rotation. So nearly every movement that we do has rotation involved, and the knee is not meant to do much rotation at all. It has a small component, but not much. So my point is load sharing. So example of that, if I do a squat onto my chair here. So if I squat down and I just keep my body upright and I start squatting down, all the force, I'll better see here, see how my knee goes so far forward? That means that all the load is going here, mainly all here. This is going to stuff my knee in no time. If I was to do 10 reps of that every day, probably about a week, I'll have knee pain. So what I need is that when I bend from my hip or hinge from the hip goes back. And as much as my hip goes back, my knee goes forward. There. This here, I've got hardly any force going into my knee. It's going through into the foot. And I feel my glute get involved here straight away. I'm actually using my back very well too. So when I park my butt on this chair, with just more weight on this leg, I bend from the hip. And I'm sitting down that way. I lean forward, push through the whole foot. And the 3 points on the foot I need to use is the middle of the heel, knuckle of the big toe, and knuckle of the little toe. So this tripod here, that should share the weight through the whole foot. If I put weight only on my ball of my foot, and I go to lower myself down without even bending backwards, that's even worse. I have more force going into here. That's why knees get osteoarthritis way too early, because the joint's just doing the wrong thing all the time, too much load going through it. So we want to strengthen your hips, the thighs, the vastus medialis muscle here, strengthen your hemis and your calves big time, because they connect behind the knee like a monkey grip and they support the whole knee. Load sharing is what needs to be done. If you have knee problems, you need to learn how to load share, how to exercise your legs really well, get the right muscles strengthened up. That's a game changer. No amount of massage will do the job for you. Massage will help the process. It can get you out of pain. Kinesiotaping can get you out of pain so you can do the exercise. We want to get the body to a certain level of better movement and a certain level of strength, where the knee's supported and not constantly a victim of not being able to move properly. I hope that makes sense. I see this way too often. People just assume that they just need all surgery in the future. Surgery doesn't always work too. It can be worse. As soon as you cut tissue, it's never the same. So exercise is the way to go. We want mainly active forms of therapy, which is exercise-based therapy for knees. Some passive ones helps. Passive is where the person's laying on the table and the therapist is doing most of the work. That helps get people out of pain so they can exercise. I can't stress this enough. The body's got more potential to heal than people realise. And the thing is about what I'm talking about with load sharing, if you don't study this area, why would you know about it? It's really important, load sharing and putting the load through the whole body, not just the knee. If you're weak in your core, it also makes more pressure go to your knee. If you've got a pelvis that's always rocked forward, it'll make more and more force go to your knee all the time too. So it's a matter of making your body, understanding how to make your body move a lot better too. All the best.